all to today's session. Myself Rajita, and in this session we are going to discuss regarding a new topic. Now, here we're going to discuss today regarding incontinence. Now, this term basically suggests the lack of voluntary control either of urination or the defecation among the client. It is a very common symptoms that are found among the patient in clinical setup. So let us study here now regarding the incontinence in details. So as I have mentioned, the meaning of the incontinence basically is the lack of voluntary control. Now among the individual client, we are going to often see the incontinence will be present related to the process of urination and defecation. So if you are discussing this two particular process of urination and defecation in a normal physiological being, we are going to see this are under voluntary muscular and neurological control. But once there is any alteration to the voluntary muscle and neuron controls, we are going to see a person will be developing with incontinence, or what we in a simple term can call it as the leakage of urination or defecation. Now as we are going to see here, the most common type of incontinence that are present in clinical setup among the clients are urinary incontinence and fecal incontinence. So first we are going to learn about urinary incontinence. So let's get started with the topic of urinary incontinence. So urinary incontinence is an involuntary leakage of urine. So as we have learned, the urinary process is under or controlled under a voluntary muscular and neurological activity. Once the voluntary function is disturbed, we're going to see the person may show the feature of leakage of urine. Then we are terming this condition as urinary incontinence. Now this particular symptoms will be developed among the client related to many underlying causes or disorders. Now here we are going to learn regarding the incidence of urinary incontinence. So the prevalence of this particular urinary incontinence is considered to be 30 to 40% among the young adult and middle-aged, whereas the prevalence of this condition will be increased up to 50% or more than that among the older population, mainly to the older women. So I hope you are understanding the concept that once we are seeing that a woman is increased with the age, the prevalence of this urinary incontinence is increasing. Now, it is a very important point to note down here. Considerably, men will be having very less condition of the development of urinary incontinence. We are going to see the incidence of this urinary incontinence will be ranging from 1 to 5% in young adult and middle-aged men. Whereas we are going to see it will be increased up to 9% to 34% in older men. So I hope you understood by this incidence that for the woman, there are more likely to development of this particular symptoms of urinary incontinence is complaint. Although we are going to see the incontinence is more prevalent among the old age population, but traditionally it's been viewed as a problem related to social and hygienic or hygiene related problem. Now this also has a major effect on the quality of life of an individual. Now this particular condition of urinary incontinence also considered to cause a serious and severe illness among the older population. So as we have learned the condition of urinary incontinence for their basic information, we have understood definitely it is a very uneasy symptoms which may affect the quality of life of an individual. So here we're going to read about the etiological factor which may develop the condition of urinary incontinence among the individual. So generally the basic phenomena because of what the urinary incontinence will be developed is here we are going to see that it will be causes when the bladder pressure will be exceeding the pressure of the urethral closure. So, as the term itself is suggesting, here the bladder will be having an internal pressure which will be almost always will be exceeding the pressure of the urethral closure. That is the reason why we are going to see the urethral closure, even if it is occurring, will cause dribbling or leakage of the urine from the higher pressurized area to the lower one. There is a reason from the higher pressured bladder, the leakage of the urine will be seen among the client. Now, any factors which basically interferes with the urethral or bladder sphincter also may leads to the development of the condition of urinary incontinence. So basically, we are going to see two pathological mechanisms. One is causing alteration of the pressure, which causing increased internal bladder pressure compared to the urethral pressure. Whereas the next pathological mechanism we are going to see, it's going to affect the urethral and bladder sphincter control. Ultimately, both of this factor is leading to the development of urinary incontinence or leakage of the urine. Now, we are going to study regarding the major and the most common disease condition which will be often causing the pathological changes and will be leading to the development of urinary incontinence. So basically, the disease condition will be always referred associated with the development of urinary incontinence through a mnemonic. Now, this mnemonic stands for DRIP. Here, the D stands for delirium, dehydration, depression. Now, this is considered that all three disease conditions can ultimately alter the functional ability of the bladder and the sphincter, ultimately more likely to increase the chances of development of urinary incontinence. The next one is R. So here R basically stands for restricted mobility and rectal impaction. Now both of this can increase the bladder pressure as well as can alter the sphincter control of the bladder. Ultimately, can lead to the development of urinary leakage or urinary incontinence. The next I stands for infection, inflammation, and impaction. Now, often infection basically associated with the genitourinary system can lead to the development of urinary incontinence. Inflammation also can cause alteration into the sphincter closure and the activity of it. Same way, impaction of the fecal material also will be helps to increase the pressure within the bladder. Ultimately, that can lead to the development of urinary incontinence. P here stands for polyuria, even polypharmacy. So basically, polypharmacy here means that usage of various medications. As a side effect of those medications, we are going to often see that client can develop with urinary incontinence. Whereas we are going to see the polyuria or increased frequency of urine due to underlying conditions or disease condition also can cause the loosening of the bladder sphincter, ultimately which can lead to the development of urinary incontinence. Now here we're going to read about certain drugs which can induce the development of urinary incontinence. It includes the alpha adrenergic receptor agonist. It is a very commonly used drug which often will be causing relaxed urinary or bladder sphincter, ultimately leads to the development of urinary incontinence. The next drug is alpha adrenergic receptor antagonist. We're going to see this also can affect the bladder sphincter and ultimately can develop the condition of urinary incontinence. Angiotensin converting enzyme inhibitors and anticholinergic drugs often will be affecting the bladder activity and the contraction and relaxation of the bladder. Next one includes the tricyclic antidepressant. So, tricyclic antidepressant also can affect the activity of the bladder, which will be ultimately causing urinary incontinence. Beta adrenergic receptor antagonist, even a calcium channel blocker, can be one of the major important cause of the development of urinary incontinence. Same way we're going to see opioids drug also increases the chances of the development of this particular condition. Similarly, sedative hypnotics, diuretics, and anti-seizure agent often will be causing the development of urinary incontinence. Now, these drugs will be definitely, if it is used in a prolonged time, then only we are going to see the client will be having as a side effect, they will be developing with urinary incontinence. Certain lifestyle factors also affect the urinary process, or basically the voluntary control of the bladder and the sphincter. Here we're going to see excessive intake or consumption of alcohol and a habit of smoking often will be causing relaxation of the musculature of the bladder sphincter, ultimately will be causing leakage of the urine. So I hope till here you understood the major and common causes which will be often associated with the development of these symptoms of urinary incontinence. Next, we are going to read about the type of urinary incontinence. So basically here we're going to see six type of urinary incontinence commonly among the client. Here we're going to read one by one in details. So the first type of urinary incontinence, and which is the most commonest type, is named as stress incontinence. Now, stress incontinence, as the name itself is suggesting, due to some stressful environment, we are going to see this urinary incontinence will be developed in an individual's body. Now, stressful environment, as in any stressful or stress if it is created within the abdominal area or into the pelvic region, which is causing increased pressure into the bladder, can lead to the development of urinary incontinence. So most of the time we are going to see as the intra-abdominal pressure here is increasing, due to that there will be involuntary passage of urine, or we can say leakage of urine through the bladder sphincter outside or external to the urethra. So basically the stress incontinence, we're going to see the person will be having involuntary passage of urine during the time of coughing or maybe laughing, even while sneezing and performing, or while performing any physical activities like performing any heavy lifting or intense exercising. All these factors can lead to the development of stress incontinence. Now you have to make it clear. Here we have learned these factors. These all factors are ultimately causing an increased pressure within the abdomen, which are in later session we're going to see will be causing an increased bladder pressure and an involuntary passage of urine, and the person is recognized to be present with urinary incontinence. Now we're going to read here about the basic causes of stress incontinence. So we have seen here basically the intra-abdominal pressure is increasing and our bladder is not able to withhold with the pressure. So there is involuntary passage of urine. So let us study here what can be the causes lying behind of the development of stress incontinence for a particular individual. So the first, if there is a relaxed pelvic floor musculature, even for delivery or once a woman is going for a delivery, almost every time they will be developed with a decreased pelvic musculature tone. It is one of the major and common cause which will be often decreasing the capacity of the bladder to hold adequate amount of urine or to withstand with the increased intra-abdominal or pelvic pressure. Ultimately, leads to the development of urinary incontinence. Mainly during the time of, if there is any use of instrumentation during vaginal delivery, or if there is multiple vaginal pregnancy related delivery is done, we're going to see the clients or basically the woman here will be having increased risk for the development of stress incontinence. Next is female urethral atrophy. Due to decreased estrogen level in the body, in post-menopause period, we can able to see a woman will be having high risk for the development of urinary incontinence. For men, we are going to see the surgery related to the prostate gland often will be increasing the development of urinary incontinence, basically the stress incontinence, as it is causing impaired ability of the bladder to withstand with additional pressure. Next, as we have learned, the first type of incontinence, that is stress incontinence. Second type of urinary incontinence is termed as urge incontinence. Here, we're going to read about what is the urge incontinence, and we're also going to learn regarding the causes of it. So, this particular condition will be occurring randomly when involuntary urination is preceded by a urinary urgency. Here, basically, we're going to see if a client is having a urinary urgency, soon after that, a person may complain about involuntary passage of urine. That is the reason it is termed as urge incontinence. Although the client will be able to communicate about their urge to pass urine, but soon after the episodes of feeling urge, they will be having an involuntary passage of urine. Basically, we are going to see this condition with overreactive bladder symptoms of urgency and frequency. If a client is present with the overreactive bladder syndrome, we're often going to see the client will be present with urge incontinence. Now, in this urge incontinence, we're often going to see the nocturnal frequency and incontinence will be very common. Leakage will be periodic, but it will be so frequent and it will be usually contain a large amount of urine. The causes of the urge incontinence includes uncontrolled contraction of the bladder. So as I have mentioned that in the overactive bladder syndrome, we are often going to see there will be uncontrolled contractions of the bladder, which is ultimately going to cause the condition of urge incontinence. Next comes the overactivity of the detrusor muscle. Now, detrusor muscle will be basically controlling the bladder activity. Here, overactivity of detrusor muscle often will be causing the development of urge incontinence. Central nervous system disorder, which includes the brain tumor or Parkinson's disease, which will be ultimately affecting the neuromuscular activity of an individual, may develop with urge incontinence. Even bladder disorders related to the bladder, which will be affecting directly the bladder and its associative organs and the structures, which will be ultimately reducing the ability of the bladder to withstand with the pressure. The examples of the disease condition includes carcinoma in situ of the bladder, as well as a side effect of radiation therapy. Also, we are going to see our client will be present with urge incontinence. The next comes the condition where we are going to see malignant growth in the spinal cord, often will be causing neurogenic disorders, where the neurology will be affected, or the neurons and the nerve system will be affected in the pelvic region, and that is when our client will be developed with urge incontinence. Bladder outlet obstructions also can lead to the development of urge incontinence. Now we are going to see about the next or third type of urinary incontinence, that is named as overflow incontinence. So in case of overflow incontinence, we are going to see pressure of urine in over full bladder will be often overcomes the pressure of the sphincter of the bladder. So here basically, due to the accumulation of the urine, there will be already overfull bladder, and ultimately the pressure which will be increased to the extent or where they will be exceeding the pressure of the sphincter of the bladder as well. That is the reason in overflow incontinence, we're going to see leakage of the small amounts of urine is very frequent, and that can be continued for throughout the day, even at the night. Urination may also occur frequently in very small amount. So basically, when the people will be feeling the urge to pass the urine, they will not be having a very large amount of urinary output. That is the reason here we're going to see, as the pressure of the bladder is more pressurized with the urine production, they will be having leakage of the urine, and they will be developed with the overflow incontinence. Here, the bladder will be often remain constant and full, and which will be often palpable through the abdomen. Even the bladder will be present with adequate distension. That is the reason the bladder will be palpable mainly in case of overflow incontinence. Now we are going to read about the basic causes or the disease process which will be often increasing the development of overflow incontinence within the client. The disorders which are related to the bladder and urethral obstructions are often considered to cause overflow incontinence. Under hyperreactive detrusor muscle will be causing the development of overflow incontinence, which often will be caused because of myogenic and neurogenic disorders. In case of neurogenic bladder and in a post-operative period, mainly after a surgery of the genitourinary system, as well as after the anesthesia, will be more likely to suffer from overflow incontinence. The next is the fourth type of incontinence is the reflex incontinence. So it will be occurring when there is no absolute warning or stress will be preceding the period of involuntary urination. So reflex incontinence will not be preceded with stress or urgency. It is a very important point to note down. Here, the urination will be frequent, moderate in volume, and it will be occurring equally during the time of day as well as during the time of night. Now, the causes of the reflex incontinence will be often includes spinal cord lesion, detrusor hyperreflexia, coordinating detrusor contraction, and sphincter relaxation also can lead to the development of reflex incontinence. So next type of urinary incontinence, we are going to see the incontinence after trauma and surgery. Here we are going to see the woman will be often present with vesicovaginal or uretrovaginal fistula. That is the reason why the incontinence will be occurring in a post-surgical period. In case of men, also the incontinence will be more likely to occur once there is any traumatic injury is occurring in the genitourinary system or after a surgical procedure. Alteration in the continence control involves the proximal urethral sphincter and distal urethral sphincter disability. Here, basically, we are going to see the proximal and distal urethral sphincter will be disturbed. The causes often includes the fistulas which may occur during the time of pregnancy, soon after the procedure of delivery or vaginal delivery. Invasive cancer of cervix also leads to the development of abnormal fistula. Even exposure to radiation therapy also can lead to the development of fistula. Incontinence is also considered a major common post-operative complication. Basically, if the surgical procedures are related to the transurethral region, perineal region, or maybe rectopubic area. We're going to see the next type of urinary incontinence is functional incontinence. Here, we're going to see the loss of urine resulting from cognitive, functional, and environmental factors. Older adults often will be developed with this problem once they are losing the ability to maintain the balance within their body. Before performing any diagnostic procedure on the patient, definitely as a preliminary stage, we have to perform a detailed history collection as well as physical examination. A history collection would include a past and present medical history, past and present surgical history, family history, as well as their lifestyle. This all data will definitely helps a medical professional to identify the probable risk factors or the causes which is associated with the development of urinary incontinence for the client. The next is physical examination. So, on physical examination, definitely we will be able to perform a head to toe examination where we will be able to find out the probable sign and symptoms that is indicating the development of urinary incontinence, as well as which will be showing the probable causes behind the development of it, as well as it will be indicating whether there is any chances of the development of complication is present or not. In the next session, we're going to see there will be definitely performance of a bladder log or voiding record maintenance. Now, voiding record maintenance or a bladder log maintenance will definitely helps a medical professional to identify the frequency and the type of incontinence that is present for the client. So information should be obtained regarding the onset of urinary incontinence and its episodes, the factors which are provoking the urinary leakage for a particular client, which will be very important to suggest the type of incontinence that is present for the client. The next one is the associative conditions if the person is suffering from, which always will be telling that what are the disease process that are present among the client within a clinical setup, as well as assessing the functional issues associated with the urination, including the mobility, the dexterity, even the cognitive function also would be assessed here. Basically, this information will be helping a medical professional to identify the exact cause of urinary incontinence and also will be helping them to plan and initiate the adequate management to prevent and promote the health of the individual. Next, we're going to see the pelvic examination plays here a very important role. So, whenever a client is present with a complaint of leakage of urine, a thorough pelvic examination would be done by a medical professional. Careful inspection of the perineal region and its skin, signs of erosion and rashes which are present definitely will be suggesting the presence of urinary incontinence and related complication development. So basically, a careful inspection of the perineal region would be done to find out any development of rashes or any development of uh, infection and other skin integrity related disorders. The next one is existence of pelvic organ prolapse also would be noted while performing a pelvic examination. So here the evaluation will be done for the local nerve innervations as well as the pelvic floor muscle strength, which will be also include a digital examination of the pelvic floor muscle, which will be showing the weakness and the tension or the strength of the pelvic muscles, which is basically a very good indicator for understanding the concept and the pathophysiology related to the urinary incontinence. Here, in a prolonged clinical setup, a nurse preferably would be maintaining a voiding log for the client or a bladder log for the client. Even if the client is discharged with a chronic urinary incontinence condition, we are often going to see here demonstration to the client should be given how to maintain the bladder or urinary block. The information related to the frequency of nocturia and urinary leakage should be noted down in a proper way to find out the exact problem of the individual. So I hope till here you got the idea that initially we will be performing history collection, physical examination that includes a thorough pelvic examination. Almost very often we are going to find the probable cause which are associated with the development of urinary incontinence for a client with this two particular step of assessment. Now, urine analysis also may be performed for a client to see whether there is or whether the urinary incontinence is related to any infectious disease or diabetes mellitus. Measuring of post-void residual urine inclined should be ensured by a medical professional with urinary incontinence. So here we need to ask the client to urinate followed by a catheterization to use of bladder ultrasound with a relative brief period of 10 to 20 minutes would be done to measure the post void residual urine within the bladder of an individual. We are going to see the urodynamic testing also would be performed for the client. Imaging studies often would be done to see or to find out the exact alteration or obstructions which is present basically to the upper urinary tract or our lower urinary tract, which will be also helping us to conclude the diagnosis of urinary incontinence and related disorders. So as we have learned here regarding the diagnostic procedure and measures, here we shall definitely discuss now related to the collaborative care which will be often done for our client to manage the condition of urinary incontinence. So I hope till here we have learned regarding the basic concept of incontinence. We've also learned regarding there are two type of incontinence which are very commonly seen, that is urinary and fecal incontinence. We have seen what do you mean by urinary incontinence, what are the etiological factors can be present behind the development of it. We have also seen there can be 6 types of urinary incontinence that includes the stress incontinence, urge incontinence, overflow incontinence, reflex incontinence, incontinence followed by a traumatic injury or surgery, even a functional incontinence. We have also discussed related causes of this all types of urinary incontinence. So thank you for attending this session. Stay tuned for the next session where we are going to discuss regarding the management and the diagnostic procedure, even the nursing roles and responsibility to manage a client with urinary incontinence. Thank you.